AI agents for addressing healthcare worker shortages, enabling scalable, intelligent health systems. The global shortage of healthcare professionals, including physicians, nurses, and allied health workers, has emerged as one of the most pressing challenges in health systems worldwide. This shortfall has wide-reaching implications, from extended wait times and delayed diagnoses to care disparities in rural and underserved areas. The imbalance between demand and workforce availability places unsustainable pressure on existing staff, often leading to burnout, attrition, and compromised patient care. In this context, artificial intelligence, AI, particularly in the form of autonomous, intelligent agents, is increasingly seen not as a replacement for clinicians but as a catalyst for reimagining workforce efficiency and system sustainability. AI agents represent a new paradigm in digital healthcare, capable of performing high-value tasks that traditionally required human oversight. Their autonomous decision-making, contextual memory, self-learning abilities, and tool integration capabilities position them as critical infrastructure for enabling smarter, more scalable care delivery models. By augmenting human capacity rather than supplanting it, AI agents offer health systems a powerful means to alleviate labor shortages, optimize operations, and enhance care outcomes. One of the most immediate and practical applications of AI agents is in intelligent workforce matching. Web and mobile-based platforms powered by these agents can act as real-time staffing engines, dynamically aligning institutional needs with available clinicians based on licensure, specialty, location, and historical performance. These systems can detect patterns in demand, such as seasonal flu spikes or public health emergencies, and mobilize temporary or remote support resources accordingly. Such platforms drastically reduce reliance on outdated scheduling practices and static staffing models, enabling more responsive and cost-effective workforce deployment. The impact of AI agents extends beyond logistics into clinical care. Virtual agents equipped with diagnostic reasoning capabilities can engage with patients via chat, voice, or video interfaces, handling triage, symptom assessment, follow-up reminders, and medication adherence. In doing so, they free up valuable time for physicians and nurses to focus on cases that require human judgment or emotional nuance. Particularly in underserved or rural settings, these agents can serve as a digital frontline, bridging the gap in primary care access and reducing the administrative burden on already stretched clinical teams. Workforce planning is another domain where AI agents are transforming strategy. Predictive analytics models, powered by self-learning agents, can anticipate workforce needs months or even years in advance by analyzing a blend of historical staffing data, patient population demographics, epidemiological trends, and even socioeconomic indicators. Such forecasts allow health systems to plan hiring, training, and resource allocation with far greater precision, reducing emergency staffing costs and enhancing resilience during periods of unexpected demand. The administrative burden on healthcare workers is a major contributor to burnout. AI agents equipped with natural language processing, NLP, capabilities are increasingly being deployed as medical scribes, summarizing patient encounters in real time and generating clinical documentation compliant with regulatory standards. Others serve as intelligent scheduling assistants, billing processors, or regulatory compliance monitors, enabling clinicians to spend less time on paperwork and more time with patients. As these agents become more sophisticated, they not only reduce burnout but also minimize documentation errors and improve operational throughput. In education and training, personalized AI tutors are reshaping how healthcare professionals acquire and retain knowledge. By adapting to an individual's knowledge gaps, learning speed, and preferred format, these platforms can accelerate upskilling and cross-training in high-need areas such as emergency medicine, geriatrics, and mental health. This is especially critical in lower resource regions, where access to specialist instructors may be limited. AI agents enable scalable, high-quality training experiences accessible from any device, ensuring continuous professional development across geographies. Healthcare worker retention is another critical challenge exacerbated by burnout and lack of institutional support. AI-powered well-being monitoring tools can track behavioral signals, workload data, and biometric feedback to identify early signs of stress or fatigue. These agents can then trigger interventions, whether through schedule optimization, alerts to human supervisors, or recommendations for self-care strategies. Over time, Such proactive engagement contributes to improved morale, better work-life balance, and lower turnover, key outcomes in a sector facing rising labor attrition. Each class of AI agent offers unique contributions to this healthcare workforce transformation. Self-learning agents are designed to continuously evolve, drawing on a wealth of structured and unstructured data to refine their predictions, interventions, and clinical guidance. These agents are particularly useful in managing chronic disease, where adaptive treatment planning can significantly reduce the need for frequent in-person visits. Memory-enhanced agents, by contrast, retain long-term context about patient histories, preferences, and care trajectories, making them ideal for supporting continuity of care in settings like dementia management or home-based care. Large language model enhanced, LLM, agents bring the power of deep contextual understanding to clinical workflows. By integrating with electronic health records and patient portals, they can assist both clinicians and patients in navigating complex medical language, translating clinical notes into patient-friendly summaries, and answering routine health questions with precision. Meanwhile, tool-enhanced AI agents integrate seamlessly with institutional APIs, devices, and databases to orchestrate everything from real-time vitals monitoring to automated research workflows in biomedical labs. At the cutting edge are self-reflecting agents, AI entities capable of metacognition. These agents not only act, but also evaluate the quality of their own reasoning and adjust accordingly. In high-risk environments such as emergency rooms or surgical theaters, such reliability is essential for supporting decision-making under uncertainty. Finally, environment-controlling AI agents introduce automation into the physical realm. From smart hospital rooms that adjust lighting and climate based on patient conditions to robotic surgical assistants that respond to real-time anatomical feedback, these agents create intelligent environments that amplify clinical capability and reduce physical workload. Together, these AI agent archetypes form a comprehensive digital workforce, flexible, adaptive, and responsive to the shifting demands of modern healthcare. They are not designed to replace human clinicians, but to support them, extend their reach, and ensure that no patient suffers due to the limitations of human labor alone. In this broader landscape of intelligent infrastructure, one of the most innovative developments is the AI agent-powered workforce health and well-being platform, a comprehensive solution aimed not just at improving clinical operations, but at sustaining the people who make healthcare possible. As health systems face an exodus of experienced professionals due to stress, exhaustion, and lack of institutional support, this platform introduces a new model for workforce resilience, driven by AI and tailored for long-term sustainability. The platform transforms how healthcare workers access and engage with employer-sponsored health benefits. AI agents embedded within the system offer real-time guidance on benefits navigation, personalized coverage support, and proactive preventive care reminders. Employees are nudged to complete screenings, update immunizations, and schedule regular checkups, reducing long-term absenteeism and maintaining clinical readiness. What makes this particularly valuable is the reduction in decision fatigue. Rather than having to navigate complex HR portals or call centers, workers receive context-aware, conversational assistance that adapts to their needs. Mental health, a growing concern across the healthcare workforce, is another focal point of the platform. AI agents serve as early warning systems by conducting autonomous well-being assessments that detect signs of stress, anxiety, and burnout based on survey data, usage patterns, and behavioral signals. These agents deliver personalized mental health resources, ranging from mindfulness practices to digital cognitive behavioral therapy, CBT, while providing anonymized trend insights to leadership. This allows institutions to tailor their workforce wellness strategies while preserving individual privacy and dignity. In addition, the platform supports cardiovascular health monitoring and preventive risk screening through AI-powered lifestyle assessments. Clinicians and staff receive scientifically validated health insights and real-time recommendations for behavior modification, such as increasing activity levels or managing blood pressure, tailored to their unique profiles. These insights not only improve employee health but also reduce insurance claims and long-term absenteeism. Beyond medical risk factors, the platform introduces behavioral change interventions and habit-forming nudges grounded in psychology. AI coaches assist staff in setting and achieving goals related to sleep hygiene, nutrition, physical activity, and stress regulation. Through natural language processing and machine learning, these agents evolve with user behavior, becoming more effective over time. They deliver actionable prompts, positive reinforcement, and motivational content in a way that is scalable and deeply personalized. Gamification is another key engagement layer. With motion tracking and team-based activity challenges, the platform turns workforce wellness into a shared cultural experience. Department-level leaderboards and collaborative goals encourage healthy competition and community bonding, while reinforcing daily movement and physical wellness, critical for workers in sedentary or high-stress roles. Perhaps most importantly, the platform supports real-time stress management and resilience building through intelligent intervention. AI agents analyze biometric signals, scheduling patterns, and workload intensity to determine when a worker is at risk of emotional or physical exhaustion. In such cases, the system can recommend breaks, suggest relaxation activities, or notify administrators to adjust shift assignments. This proactive support is essential for reducing attrition and sustaining long-term performance in mission-critical care environments. Taken together, the workforce health and well-being platform complements broader AI agent-driven strategies for healthcare workforce management. While AI staffing engines ensure coverage and AI scribes reduce administrative overload, this platform focuses on retaining and empowering the workforce by caring for the whole person, mind, body, and spirit. It turns reactive wellness programs into proactive, intelligent systems of care, aligned with both clinical quality and human dignity. As healthcare systems worldwide seek to stabilize under the pressures of demand surges and workforce attrition, the convergence of AI agents and employee wellness platforms points toward a more sustainable future. These systems don't just make care delivery more efficient, they make the work of caring itself more humane. In doing so, they ensure that the professionals we rely on to heal others are supported, seen, and empowered in their own right.